Hello, I'm Mercedes Byrne-Klug with the University of Iowa School of Social Work and the Aging and Longevity Studies program. And we're going to talk a little bit about Iowa's community colleges today. I have with me Paula Nissen. And Paula, would you like to introduce yourself, please?
Sure. I'm Paula Nissen with the Iowa Department of Education in the Community Colleges and Workforce Preparation Division of the department. I serve currently as the interim bureau chief for the Community Colleges Bureau. And so on my day-to-day work, I do research on educational outcomes studies, but I'm double dutying right now.
Okay. All right. Well, I understand you have a PowerPoint that you might want to share with us.
I do. Okay. So now we've got the PowerPoint up, so we'll just run through it a little bit, and I'll give you a little background on what Iowa's community colleges bring to the communities across Iowa. They are known as the Workforce Trainers of Iowa. We have 15 community college areas across our state, and all of the logos, as you can see, are very colorful, and they're everywhere. They are all locally governed and serve each one of their regional communities across our state and offer many different programs and options for the people across the state of Iowa. They also work very collaboratively. Iowa's community colleges provide individuals with access to the high quality customizable education and training as they work with business and industry partnerships, with high schools through partnerships, developing pathways for not only youth, but also for people that are in their maybe second or third career in life. They implement all kinds of different programs, and part of my job at the Department of Ed is to then evaluate a lot of the programs through outcomes regarding work to see what people make once they get their education and go into the workforce. So that's what that's about. And there's many, many different things other than that. They serve through credit enrollment, and as you can see, there's 128,624 students last year. So there was a lot of students coming in the credit enrollment programs throughout the state. They also, demographics-wise, serve 55.1% of those credit enrollment students are female. Very high minority population at 23.1% of our minority population. Average age is 21, but 31.4% of the students that are in credit enrollment are age 25 and older. We also have online enrollment programs. So there's 62,731 students that are enrolled in online programs. And they are, as you can see, over 446,000 semester hours that are taken online. And approximately 24.4% of the population that takes online classes is also over the 25 years or older, giving them the option to work and also go to school at the same time. Joint enrollment, we are #1 in the nation for percentage of high school students that enroll in classes through our community colleges. Over 50,000 of our high school students last year were enrolled in college credit programs. We also serve developmental education. We had nearly 10,000 students last year enrolling in over 49,000 credit hours at an average of.
What does that mean, developmental education, Paula?
These are students that are not quite ready yet for the college courses. And so sometimes they take college courses while they're taking remedial or developmental education studies, but they also can take some of these courses prior to taking college courses so that they're more likely to succeed. It's a very good thing that some of them want to or opt in to take these types of courses before they actually start their college career.
And can I ask you another question about this?
Sure.
This is really interesting.
Sure.
So how about for people who have been out of education for maybe 10, 20, 30, or 40 years?
Sure.
Do you see some of those students coming back to learn how to use the computer in the classroom and all the high-tech stuff? I mean, is that a good idea for our older,
Yes.
midlife and older adults?
Absolutely. We also have adult education classes in case maybe language might be an issue, coming back into a school setting. For those that are past the high school age, they can go and take adult education courses too, which gets them more up to speed in the technology components and or English as a second language, all kinds of different things that are options for them out there. You bet. Yeah. We also offer a lot of non-credit enrollment courses and programs, and these are classes that students take. Normally, there's over 60% of our students in non-credit, by the way, are 25 years or older. These, for example, might be if you're looking at becoming a truck driver, for example, and you just want to go in and you want to learn how to get your CDL or train to get your CDL, your commercial driver's license, so that you can drive a semi, for example. You can go in and take these classes and get your certification and then go to the DOT and test for your commercial driver's license. That's one example. Non-credit enrollment also is like for CNA or certified nursing assistant programs. You can go in there, get the training that you need, and then go and test and sit for your certification for your CNA also. We have a lot of those across the state that happens. And some of them are high school students, but the majority are usually in the older population group or over 25 years of age or non-traditional students that are looking maybe for a change in their career, want to maybe pursue registered nursing or something to that effect. Non-credit enrollment is our biggest enrollment across the state, and we serve a lot of people that way with different types of industry credentials and certifications, short-term and long-term certifications. Then as I mentioned earlier, there's the adult education literacy. We have over 16,000 students that are in those courses as well. So 7%, a little over 67% are in adult basic education, and 33% are also in the ESL or the English in a second language classwork. And as you see there on the screen, there's almost 50% are between the ages of 25 and 44 years of age.
Now that ABE, that's a new one on me. What does
Adult
that
basic
mean?
education.
And what is included in adult basic education?
That is like working on or trying to work toward getting your high school equivalency. So, yep.
Oh, okay.
So some of our students that haven't received their high school education or diploma through the regular coursework, and the majority of them are older, they will come back then and they will take the courses to then eventually test and do their high school equivalency test. Yep.
Thank you.
As you can see, we've got a lot of different components of the community college system. Another interesting fact, when people do complete their education and training at a community college, if they're in the credit program, 87.2% of those completers, the people that complete the programs at our community colleges across the state, end up working in Iowa. So we keep a lot of our community college students, whether young, old, or indifferent, all in the state, which that's something we all want to strive to keep, right? Then the non-credit awards, as you can see, we talked about the non-credits, 90% of the students there stay in Iowa. And the vast majority of our non-credit students are either working prior to their education, maybe got laid off, dislocated worker, or decided they wanted to change and they'll enroll, or they are working to improve their skills in different types of training while they work. A lot of the students, as you can see from the previous slide, over 60% of our students are over the age of 25, and the majority of those are currently working. Say you're working in a retail environment and you really like to get a different type of career. You're taking classes online in the evenings or attending classes in the evenings face-to-face to try to upskill or get into a different line of work that maybe makes more money for you. You could do that. It's a customizable type program that you can come in and do. A lot of our schools also work in partnership, as I noticed at the first of this discussion, that they work in partnership with the employers locally. And so the employer might have a certain type of training program that they would like to develop and send their workers to, so that they can upskill and be better workers within the current employment. So there's a lot of different variables, a lot of things that can happen with the training that the community colleges across the state provide. Few other things to mention, since you are with the University of Iowa, we do have reverse credit transfer, and that allows people to have some training maybe at the community college. They can transfer to, say, the University of Iowa, then take those credits that they've acquired and maybe acquire that associate's degree that they didn't quite finish at the community college, but maybe they did some coursework at University of Iowa that would then get them that associate's degree, which moves them on then to maybe a bachelor's degree. We also are offering the summer college credit program, and that's for joint enrollment students or high school students. We didn't used to have that option available for high school students to actually attend credit programs during the summertime. And we just started that. This was our second year with that program. And so there was about, I'd say, nearly 700 students that completed courses during the summertime this last year. So that was really
wow, that is impressive.
Yeah, pretty cool. And then just this year now we've started in on transfer majors, and that's where there's a partnership between the Regent universities across the state of Iowa and the community colleges, where that student might intend to someday transfer to a four-year institution. They'll want to go ahead and declare a major so that they can then transfer those courses directly into a program at a four-year institution through this transfer majors program. We've got, I think there's 24 of them or 27 of them right now that the colleges have approved, and in partnership with the other four-year institutions that they have those articulation agreements in place. So it's pretty exciting for students to be able to choose a major and then maybe attend the community college and move on after that, transfer to a four-year institution.
And Paula, you mentioned that you have agreements with all three of the Regents universities, University of Northern Iowa,
Yes.
Iowa State University, and the University of Iowa.
We do. Yep, we sure do. And they work very well together and try to make it as easy as possible for students to continue on their educational journey if they so choose. Yep.
Okay.
And then we also have developed an online outcomes access page. And this is for, say, a student wants to go out and see what type of training they should get or could get and what it might pay, how quickly they become employed, all of those things research-wise. They can access this page and go to there and find out if I completed a welding program that's short-term, how much would I make and how likely am I to become employed the first year after I graduate? All of the information that we research and have is kept on this site so that students and teachers and counselors alike can utilize this to help guide students in a way to find what's better for their future. So that's data driven there, if you're into numbers. And then just to conclude, I just wanted to put a shout out to all the community colleges. They do offer open access to everyone in Iowa, all students in Iowa. They work very collaboratively amongst each other, sharing information. There's actually 15 work-alike groups across the state, whether it be for institutional research or for non-credit programs or skilled worker job creation fund programs and tuition assistance, things of that nature. Everybody's always talking, and they get these groups together so that they can share best practices and help each other out. It's also the most affordable education in the state of Iowa. There's pathways that are built for success for students that would like some guidance in a path that they might choose. Maybe some don't. That's okay too. And then we want to make sure we're identifying the bridging of the skills gaps for each of those students, giving them an assessment of what they're missing in order to become successful. They also help with economic growth in each one of the communities, upskilling those people to get them into jobs in order to have the employers be successful. Community colleges are, the reason they're called community colleges is because they are community oriented. They do a lot of work in their own communities. They have a lot of community connections through employers, and it's really something that's quite unique and great for a school type atmosphere. And then they are a very big value to our state with the economics they bring to our state, the students that they train, and everything they provide for their communities. And that's really all I have. But if there's any questions at all that you might have, I will try to answer them. I'm not an expert in everything, but I will most certainly know someone that is.
Well, thank you also for including your email address and your phone number. This was very good information.
Sure.
Yeah, if you want to stop sharing your screen up, I have just a few other little questions for you.
Sure.
That was so interesting and so helpful in understanding the important role that community colleges play in our state, and also that there have been pathways already worked out for students to start actually in high school, take some community college credits, then maybe go to the community college, and then there's these pathways already developed to go to Iowa State or UNI or to the University of Iowa.
Correct.
And my interest is, of course, in training students and the workforce to work with older adults or work with issues impacting older adults, and also to help older adults recognize the opportunities for education right here in our state. And it just sounds like our community college network is doing a wonderful job.
Yes, they are. They keep plugging away. Have to be very flexible, that's for sure.
Do you see any special challenges for people who may be starting on their third career or who have been out of the workforce for over a decade or something like that? Are there certain challenges that people face coming back?
Well, I think sometimes technology can be. Just from what I've dealt with before, I've seen that's probably the biggest hurdle for a lot of folks, is that technology component. But I'll tell you, the colleges all have everything as far as infrastructure in place to help people to work through that type of upskilling and training. And there's all different levels. So from the very beginner to the intermediate to then more skilled, all the different levels are there. Different options for face-to-face versus hybrid, some online, some on face-to-face, and then 100% online. So if you really don't have that type of a skill and you need the assistance, it's going to be there for you. Yes.
I also think that's important because sometimes people who've been out of the workforce for a while are concerned that when they get employed, they're going to need to have some computer skills that they might not have. So going back to school and taking some classes and getting kind of warmed up with the big support that's available through the community colleges or through our other colleges and universities statewide is a good way to kind of get some help in catching up with the technology. And then that makes the transition into the workplace a little bit easier.
Absolutely.
Well, thank you so much, Paula, for spending some time with us today and letting us know about the resource right in our own backyards here in Iowa.
No problem, anytime.
Okay, let's go ahead and start, introductions. So I'll go first. My name is Reddy. I'm the chair for the Aging Services Management Program at DMAC in Ankeny. We have two other members of the panel. I think I'll let them introduce themselves at this time. Please go ahead. Laura?
Hi, I'm Laura Green. I am the program director for the Occupational Therapy Assistant Program at Kirkwood. I am an occupational therapist and now an educator, and have been in higher education now going on 7 years.
Okay.
And my name is Debra Forbes, and I am Associate Professor of Nursing in the nursing program at Kirkwood Community College in Cedar Rapids. I've been a nurse for 40 plus years, and I have been in higher education now for a little over 12 years. And I teach the introductory first semester nursing course, which has a focus on care of the older adult.
Okay, thank you all. As they're putting together to celebrate their 40th anniversary of their program at the School of Social Work, Dr. Bowen asked me to kind of see if we can put together some session, having some members from the community college especially to have the panel discuss on the pressing issues, especially I think given the pandemic situation that we are going through now. And I was hoping for an in-person conference, but now all the sessions are going to be online and like every other conference. But I think we'll just stay to specific topics relevant to what we do in terms of our own line of work. So I've been a nursing home administrator for managing skilled nursing homes for more than 13 years before joining the DMAC as an educator, teaching students how to become a licensed administrators. So that's my specialization. So majority of my students actually are who are already working in the long-term care, and they want to make some professional growth. They want to become nursing administrators. These students are basically, they are majority of them are department heads, like departments like nursing, director of nursing, social workers, and admissions coordinators. I mean, like I said, majority of the students are, of course, they want to become licensed administrators. But we have students because we have certified 6 different tracks here, and then it depends, individually tailored, to specific needs of, the goals of, individual students. So you can tell us a little bit about your programs.
So our program is 2 years in length, and we thread sort of concepts of working with elder populations kind of throughout the entire 2 years. So the first time that they come in, we begin to have a discussion surrounding like understanding how we develop across the lifespan. And at a certain point, we cover that elder population so that we can understand what it means to with normal development, because the idea then is that as we transition and move throughout the program, we start to talk about more abnormal development. We also have threads of addressing elder population from a perspective of health promotion. So the idea is addressing this population for reaching out to them for healthy behaviors, making changes in the way that they do things, identifying risk for injury and illness. We also, throughout all of our intervention courses or our treatment courses, we talk about maintaining abilities as we age. We talk about barriers for participation and successful aging. And then we also talk a lot about how do we modify and adapt the environment. And so really over the course of those 2 years, we're kind of covering those concepts threaded throughout most of their classes, because then the idea is that no matter what age of population we're treating, a lot of the interventions and treatments, some can be correlated to most of them, but we do spend a portion of time just focusing in on elder populations too.
The Kirkwood nursing program, there's a prescribed number of prerequisite courses students take to get to the actual admission to the nursing program. Overall, from the prereqs to the end of the program, it's probably about a 2 to 3 year process, depending on that student's track. We have a lot of students that are not traditional students. So we have students that maybe have been out in the workforce doing other jobs at this point. A lot of them are working in healthcare as CNA and techs. A lot of them work in long-term care and have identified that they want to focus on that area and have a higher level of responsibility and a role in that care of that older adult. Part of the prereq process is they have to have their CNA certification, which again explains why a lot of them are working as CNAs. And the CNA program is really their clinical focus is on long-term care. That's where they do their clinical experience. So they've got some long-term care experience and some older adult focus when they come to the actual nursing program. The thing I focus on with my students in this first semester of the nursing program is we talk about care of the older adult. We talk about how our population is shifting to more and more older adults, a higher percentage of older adults, and that's going to keep increasing over the next several decades. So most of the people we're going to take care of, no matter what the healthcare setting is, they're most likely to be older adults. And so we talk about the complexity of their care in healthcare settings. We talk about transitions between healthcare settings. What happens when people are transferred from home to a healthcare setting or between healthcare settings, and the risk for things happening to people in those transitions. We also focus a lot on not specifically disease management, but quality of life issues. How do we keep people at home and safe and following the management that they have for their chronic health conditions, but keeping them at home? So patient education is a huge piece of what we talk about in the course that I teach. As they go on through the program, then it shifts more to acute care and disease management. But there's always, I have students that come back that have finished the program saying, what we learned about older adults helped me all the way through the program. And there are students that go back to long-term care or work on home care environments or places where they're working with older adults because they discovered that love of caring for older adults and the quality and the interactions and the communication with older adults that they so enjoy.
Okay, thank you, Debra and Laura, for sharing. I think one thing I noticed is that listening to you, it's in the broader context, basically we are all doing the same thing but through different means, in terms of the courses and the training that we provide to our students. More and more younger people are joining. That is a good thing because. So the workforce, I think will diminish unless, we impress upon these younger students, to stay in the field. How can we help our students?
Well, one thing we do in the Occupational Therapy System program at Kirkwood is that we talk about cultural sensitive care. And just having an understanding of the varied populations that you're working with. And one of those is with our elder populations, and just recognizing some of those myths and trying to sort of break some of those myths and provide just better care overall. I think another thing that we do in terms of just really preparing students to work with this population is to try to make them be those general practitioners, because the needs are so varied within this population that they really have to be that practitioner that can address all areas. And we do that in several ways. We do it within the courses, right, that they're going to have an opportunity to work through, but then also through the varied settings and fieldwork that we send them to. And with that hope is that once they come out, that they really can not only just work with varied populations, but work with specific populations with varied needs, right? So not only just the fact that they could treat any and all different types of people, but also people with complex varied needs.
I think for students that are coming into the Kirkwood nursing program, I think a lot of students have misconceptions about that older adult population. I think a lot of them don't know people that are older adults, maybe just outside their grandparents, that maybe not be as old as some of these people they're going to start working with. I think that there's misconceptions about that older adult population. And Laura, you mentioned that cultural sensitivity. We talk about culture, we think about culture in different ways, but being an older adult is a culture. That's a part of our population that's different. And that's, I think, the point we try to make is that older adult population is a cultural thing that we need to be aware of, and how do we provide care to those people. The problems are so complex. You mentioned that as well, Laura, is that it's not just they've got this one problem, it's this problem with all these other problems. One of the first things we talk about is issues with mobility. And that underlying issue can impact their whole entire life and all the chronic health conditions that they have. So that's kind of weaved through our curriculum, is that issues with mobility, we've got to keep them moving, and what are we going to do about that? Our clinical experience for this semester is in long-term care. Now, we haven't been able to do that for a couple of semesters because the long-term care facilities are closed to people outside of that just work in that facility due to COVID-19. But typically our students are in long-term care. I have students that are absolutely terrified to go to long-term care. And just to share a quick story, we had a student a couple semesters ago that was absolutely in tears the first 3 days she was there. And the instructor held her hand the first 3 days, and she just blossomed, and she just fell in love with that older adult population. So I think students need that experience. They don't know about it. A lot of them haven't worked in long-term care, but I think it provides that opportunity for them to get a different perspective on that older adult population, that they are valuable, that they have valuable thoughts and ideas and perspectives on things that our younger generations need from this older adult population.
But I think the competencies that we develop in our own programs, I think we should address that issue about putting those competencies that specifically address how to how our students can go and help the elderly in any way they can in different areas, not just in one area, but I think different areas. I think Laura and Debra, you said, yeah, I know your programs are a little different than mine, but not so different in terms of the eventual goal. So you have any thoughts about that?
Well, I think nursing in particular, it's not just about preparing my students to work in long-term care or a hospital. I tell my students that care is transitioning. We're in the process of a huge transition in providing care to our patients. That care is going to start transitioning to more localized, community-based care, and not so much in those facilities per se, long-term care, assisted living, a hospital-based or clinic. That care is going to start transitioning to meeting people where they are, in their homes, in their living environments. And I think that is where care right now, healthcare, is going to start transitioning as our population ages. We want to keep people in their homes and in their preferred environment for as long as we can, and we've got to meet them where they're at.
Yeah. No, I was definitely, when Debra was talking about that whole idea of them wanting to stay in home, we want to keep them in their home. That's definitely one thing that occupational therapy focuses a lot on too, is because people do want to age in place, right? They want to be able to stay in their home. And so we have to find creative ways to allow them to do that, right? From a mobility perspective, from a cognitive perspective. And we also have to understand how those, as they're aging, those roles in their life are going to change, and that impacts how functional they stay within their home and in their community. And so within our program, we address those and find ways in which to treat and work with clients based off those needs. But really the focus is whether we're in skilled nursing, in home, in hospital, in community, the focus is how are we going to keep them as functional and as independent as possible, so that they can enjoy those years as they transition.
Thank you very much for having this conversation. Community colleges do a lot to help prepare the workforce here in Iowa, the very important part of the workforce development in Iowa, and also help in giving people the skills and the education to more fully participate in our society. And do you see midlife and older people in your classes, taking your nursing classes?
I do. I actually have 3 that are probably, this is like their second career. They've had a job and they've decided, I want to do something that maybe has some meaning for me. There's something that's happened in their life that they want to redirect what they've been doing. They're bridging off what they've done before, or it's a total career change to go back to school. So yes, I do see people, not specific. I have seen people that are like in their 50s coming back to the nursing program because they want to do something that they feel like is going to have meaning for the remainder of their work years, or something that they can use in their own personal life.
And how about in occupational therapy, Laura? Are you seeing midlife and older people coming back to the community college to get skills in that area?
We do. Every year, I have a few that will come in as second or third careers. And so predominantly, most come straight out of high school and span in through like mid-20s, but I do get some in that midlife range that are coming in as second or third careers. I have some thoughts too in terms of how we are addressing or preparing our students to understand those transitions that older adults go through. You know, in the field of occupational therapy, we use occupation as a way in which to work with and treat our clients. And so those occupations include things like leisure, understanding your roles. And so we have worked with the Agency on Aging, but we also teach our students in terms of having an understanding of what the resources are out there that they could be educating clients on. We also talk a lot about modification and adaptation, because the idea is that we understand there's a dramatic shift as you transition into that stage of life. And so we have to kind of be thinking about how that's going to look a little different and what we can do to help them transition into that period.
And I think too, those students that are midlife or a little older that are returning to the classroom bring a unique perspective to what other students are learning. So right now I have a mix of traditional students that are coming, they're a couple of years out of high school, they're in their early 20s, and students that are in their 40s and 50s. And I think in our classroom discussions, those students that have more life experience bring a different perspective to the classroom and the topics that we're discussing. And I think they really help each other. So I think there's a huge benefit to that.
Yeah, you know, that's a very great point, Debra, because I was thinking about my classes when I used to teach face-to-face. Now I don't do that. You know, I used to see, you know, a person who is in their 40s or whatever, you know, sharing her or his experiences, you know, from, you know, the job that he or she was working at with the younger people who are in their 20s. So that helps. It's a, you know, I mean, that is something that is missing now in my program.
Well, I want to thank you all for talking about what you're doing to help prepare the Iowa workforce, people of all ages, for their first, second, third, or fourth careers in life, and the important role that community colleges play in our state. And thank you for everything you're doing to help prepare people to really participate in the Iowa society. Thank you so much.
Thank you.
Thank you, Marcy.